In our series of Docplexus KOL interviews, we have with us Professor Dr. Maurizio Nordio with us. Dr. Nordio is a specialist in endocrinology and has done a PhD in endocrinology and metabolic sciences. He is the professor of neuroendocrinology with research interest in myoinositol, melatonin, and thyroid metabolism. Thank you so much, sir, for sharing your valuable time with us.
You're welcome.
Dr. Nordio, can you please highlight current challenges in the field of gynecological endocrinology in general?
Yes, of course. Hormones are very important to all individuals, and in this field in particular, we have some hormones that has to be measured, and these are insulin and thyroid hormones, because many patients in the OBG field may have illnesses according to these two hormones. And in particular, as far as insulin is concerned, if you are overweight, you may have insulin resistance. This means that you produce a higher amount of insulin with respect to the glucose that you have to metabolize. But if you do that, you get a lot of problems, additional problems, because your pancreas is doing worse. And you can modify this by moving yourself and by eating less. However, not every time this is possible. Therefore, it might be possible that you have to take some medicine. And today, we have some natural medicine that can be taken. This is for the insulin. And again, we have the thyroid. Most of the patients in OBG field might have also thyroid problems. And if they have, you have to fix their thyroid problem. So it is important in all OBG patients to check also the thyroid.
Okay, sir. So, Dr. Nordio, how the factors such as obesity, diabetes, and other metabolic disorders can add to the complications of OBG problems?
That's right, absolutely. As I said earlier, this is depending on insulin, the so-called insulin resistance. And if you have it, it is like the dog that is biting its tail, going around and around. Therefore, you have to change this. This is no good to have high insulin levels, because this is the road to the diabetes. And unfortunately, India is one of the most important countries with the highest level of diabetic patients. So let's do something. And today we can do something, despite the fact that you have to eat less and move more.
So it's more about the regular changes that you make in your
That's
your
right.
life,
That's right.
rather than being dependent on the drugs.
That's perfectly. I agree 100%. The road to diabetes takes decades to drive you to the diabetes.
So one should focus on the lifestyle change.
That's right. That's the most important thing. And you obtain better results also if you change your lifestyle and you add some, let's say today we have nutraceuticals that are much better, and so you can use them and you get higher results.
So being cost effective, metformin is highly prescribed and used as a go-to drug in PCOS. But in your opinion, how effective is inositol when compared to metformin?
If you don't mind, I will answer with an example.
Sir, please.
Of course, metformin has a very low cost. Of course, metformin is a very well-known drug. Since 60 years it has been used. I agree with that. However, today we know something that is like that. Let me answer with an example. We have a door that we have to open, and we have a handle. We have to open the door, so we call a person that by chance is called metformin. So we call metformin and ask metformin, please, metformin, can you open the door? Metformin is coming, and we realize that metformin has no hands to open the door. Oh. And metformin is saying, don't worry. Metformin is calling someone else that by chance is called inositol. And inositol is coming. And inositol has hands. So it is inositol that it is opening the door, not metformin. Or let's say it is metformin through inositol. So now we have inositol. So technically speaking, why should we give metformin? It is just a matter of changing our minds. Let's go ahead. Let's do a step ahead. We have natural things. And another thing is that when you prescribe metformin to young patients, they will tell you, oh, doctor, I'm not diabetic. Are you prescribing me something that is good for my grandma? And metformin may have adverse effects. So I'm not here to say that metformin should be abandoned. That's for sure not. But we have additional tools today to do things better in the very natural form.
Can inositol be used as a primary therapy, or should it only be used in adjunct with metformin?
I don't agree with that. No need to be used in conjunction with metformin, because we know that metformin is acting through inositol. So no sense the combination metformin with inositol. We can use it as a primer therapy, and especially in young people, and see what will happen. The therapy is about 3 months at least to see the results. But the doctor can decide, is the only one that can decide how to go on and on, if he can stop the therapy or continue or whatever it is, or change the dosage. For instance, one thing is important. I've always been asked, how long should I continue the therapy? Well, there are data in the scientific literature that are saying that if you get pregnant, you should take inositol, because inositol is able to decrease the percentage of complications derived from gestational diabetes. So this is something very heavy, something very important.
So can you please highlight your findings about the concomitant of the Myoinositol and D-chiroinositol therapy in management of patients with metabolic disorders or PCOS?
Okay. Yeah, what we did is just to try what we could use. So we tried the combination because inside our organism there is a certain ratio between two forms of inositol that are called myo or myo, myo and DCI, that is D-chiroinositol. We have a certain specific ratio inside our body, our organism, that is specific in every single tissue. We cannot give a tablet with a different ratio, a tablet for the muscles, a tablet for the liver, a tablet for the ovary. Of course we cannot. Therefore, a plasma physiological ratio has been found that is 40 to 1. And now there are preparations that they contain this ratio. We tried that, and we gave to PCOS patients and see what happened. Well, what happened is that things went in the perfect way more quickly than with the use of one single inositol, that is Myoinositol. So the combination is acting faster. And this is a very good point, because in PCOS patients, they want things to be very fast. As I said earlier, they don't want the result tomorrow, not even today, but they want the result yesterday. They want it, if possible. So to be fast is a very good thing, and the combination is fast. And again, it is preventing the progression of cardiovascular risks also.
That's all for today, sir. Thank you so much for sharing your valuable time and knowledge with us.
You're welcome. Thank you.
To stay updated on our latest KOL interviews and videos, please subscribe us on our YouTube channel, like us on our Facebook page, follow us on our Twitter. Happy Docplexing!